Hello guys, this is Lily and welcome to my YouTube channel. In this video, I'm going to discuss with you about SOAP or SOAP notes for massage therapists. Okay, so this is a study guide to help a massage therapist in writing a SOAP notes in their practice. So what is a SOAP note? Okay, so SOAP in the SOAP note is an acronym for the S, subjective, for the O, objective, for the A, assessment, and P for plan. Okay, so it is a method of documentation employed by massage therapists to write out notes in the client's chart. It helps in accomplishing the massage therapist's duty to assess, to treat physical dysfunction and pain of the soft tissue and joints of the body. Okay, so if the treatment is the client's first visit, then the massage therapist will get the client to fill out a confidential medical health history form. Okay, guys? Okay, so this is an example of a comprehensive or complete SOAP notes that I have used in my massage therapy program. Okay, during my study of massage therapy program. Okay, so here I write down client's name, the date of the treatment, the therapist's name, of course, and then down the line are the the SOAP, or the subjective component, the objective component, the assessment component, and the plan component. Okay. So the subjective component of the SOAP notes is initially the massage therapy client's chief complaint. Okay, so the client comes to your clinic and will tell you, or we are gonna ask what is his or her chief complaint. So this is the area where you write it down in your notes. Okay, so this is a statement of the client's purpose for getting a massage treatment. Here you go, guys. Okay, so I just put in summary, so that's where you can write down a summary of your chief's, a little information about the client's chief complaint. Okay, so under this subjective component, it's very important that as a therapist, you're gonna ask for pain assessment. Okay, so the pain assessment, the questions you will be, or the information you will be asking from the client or clients are the following. So there's a mnemonic, Lord Ficarum. Okay, Lord Ficarum. So the L is the location. Okay, so location means the location of pain or tenderness on the client's complaint, okay, or whatever the client's purpose of coming for treatment. Okay, so location where the client's pain is. So you're just gonna ask the client to show you, or pointing with one or two fingers where his or her pain is on the complaint. Okay, so next information that you're gonna ask the client is the onset. So when did the pain start? Okay, so the onset of the pain of the complaint. Okay, so the client will answer. It could start in a month's time, 3 days ago or a week ago. So you're gonna record that under the subjective component. The next is the referral, which means if the pain refers to other areas of the body. So when the client feels the pain, is there a referral pain? If it's in the arm, down the arm, or it's in the leg, down the leg. Okay, so referral pain. This is what it means here. Okay, the next one is the duration. Okay, what it means, like you're gonna ask the client for how long the pain lasts. If the client is having pain at the moment, then you're gonna ask the client for how long the pain lasts. So you're just gonna record that as well. Okay, so the F is the frequency. So how often the pain lasts when the client is having that pain at the moment. So you're gonna ask the client this question. and record this in your notes. Okay, so the next is the intensity. Okay, so what is the severity of the pain? So how intense is the pain that the client is feeling at the moment? Okay, so you're gonna ask the client about that. So with intensity, you're gonna ask the client in a scale of 1 to 10, 1 being the least pain and 10 being the worst pain. So you're gonna ask the client, what is this pain scale? Okay. Okay, next on the pain assessment, the characteristics of the pain. So here you're gonna ask the client if the client is feeling a dull, a sharp, achy, or shooting pain. So you're gonna be asking the client the characteristics of the pain, and you're gonna record this as well on the note. Okay, the next is the aggravating factors. So aggravating factors, examples of this that you're gonna ask from the client: if the client is using any drug or drugs, is there any aside from the medications that the client is taking as prescribed by his or her family physician or doctor, and is there any activity or activities such as exercises or any sports that the client has been doing in the past that aggravates, the pain on the area that he or she is complaining about. Okay, about the the client's posture, as we all know that we sometimes, or most of the time, we ignore our posture, so we tend to slouch a lot, and that will aggravate the pain as well that a client is experiencing, should be dealing with the pain that the client should be dealing at the moment that the client would want a treatment. Okay, so the next is the relieving factors. So in this note, we're gonna ask the client if the client is taking other medications or drugs that can relieve his or her pain. Is there any activity that the client do to reduce or relieve the pain that on the area that he or she is complaining about, like doing some stretching exercises, going to the gym or walking, swimming. So that's something that can relieve pain as well. Okay, so if the client's posture is good, so good or normal, the client is maintaining a good posture, so that could relieve pain as well. Okay, the next in the pain assessment is the associated symptoms. So you're gonna ask other symptoms aside from pain. You're gonna ask the client if the client is feeling some tingling sensations, if the complaint part is the arms or the legs, any numbness as well, and if the client has fever. Okay, so these are important symptoms that you should be asking your client. The next one is the history. So if there's any previous history or injury related to the area that the client is complaining about, is there any family history of this complaint on the pain on the area? Is there any previous or family history about it? So it's important to ask the client as well. Okay, so the medications. So during the treatment or previously the client has been taking any medications to reduce the pain or to give the client a relief of the problem that the client is complaining about. So you're gonna ask the client all the medications that the client is taking, and you're gonna note it down here on the SOAP notes. Okay, so additional notes in this, there's a space here that I have put in. So you can write additional notes regarding the client's chief complaint on this area here, space. Okay, So the next one on the SOAP notes is the objective component. So this objective component includes the massage therapist clinical observation, the doctor's diagnosis, like x-rays, and the four T's of palpation. Okay, the 4 T's of palpation. So you're just gonna write it down here on this on the SOAP note. So I just put in summary, just a little bit of, summary of a little bit of information that you would like to put in the objective component. Okay, so what includes in the objective components? So this is all about your observation as the client is approaching you, walking towards you. You're already checking on the client's posture. Okay, as the client is sitting, you're gonna check the posture of the client for the assessment. So the anterior view, especially when it's the initial treatment of the client, you're just gonna get all this information. So anterior view. So you're gonna check the external auditory meatus. Okay, so that's one you're gonna check. Okay, so there is the checking the mandible, if it's midline or deviated. The head position, if it's centered or tilted. The clavicles, symmetry or balance. Okay, so the rib cage, the shape, if bilaterally, if it's pigeon chest or barrel chest, then you have to check that as well. Okay, so for the posterior view, in standing position, you're gonna check the anterior view, such as the external auditory meatus as well, the mandible, the head position, the clavicles, the rib cage, the fingertips, the anterior superior iliac spine, the ASIS, okay, or the iliac crest, bilateral. So meaning on both sides, you're checking the symmetry or balance. So you're checking for any abnormality, okay? So the quadriceps muscles, you're checking for if there's an even bulk or tone or tightness, the appearance of the gastrocnemius quadriceps, the quadriceps muscles, which is on the anterior or the front of the upper leg. Okay, so the patella, so it's located on the knee area. The patella on both sides, if it's level, so if the angle is, as you look at it, it's level, the other one is not higher than the other, so you're looking at an abnormality. For the knees, if the knee is valgus or varus, so bow-legged, and the other one is like there's more of space in between. Okay, so valgus, bow-legged, and varus, more space in between. Okay, so the medial longitudinal arches. Okay, so it's on the feet or the foot. So the pronation and supination of the foot. Okay, you're gonna check on that if it's flat-footed or not. So yeah, the feet, the pes varus, 2 in, or pes valgus, 2 out. 2 out. Okay, so you're looking on all of it, okay, during the assessment on the objective component. So you're assessing the client based on that. Okay, so posterior view, so you're looking at levels of external auditory meatus. Okay, so angles of the mandible for lateral tilt, if there's lateral tilt. Okay, so the acromioclavicular joints, bilateral level, if it's balanced, the other one is not higher than the other. Okay, so you're looking at it as well. Trapezius, erector spinae, the bulk, or how the appearance of the muscle, the tone on both sides, and both muscles on both sides. And okay, so to continue, the inferior angle of scapulae, and both scapula, the level, if it's the level of the scapula is even, and the distance from the spine or the vertebrae. So most of the time you'll see in here if the client is protracted, meaning there's like a curve on the rib cage, on the mid back, like a little bit of, you know, curve there or more curve in there. So you're just checking that as well. The arm position, so compare the space between the arm and torso. So your arm, the space, so you're gonna be checking on that. If it's like more space there or less space, so you're checking on that. Is spinous process, the straight line or deviation. Spinous process. So you're gonna check if the vertebrae, the spinous process on the vertebrae is straight or it's deviated, there's a curve. So you can detect for any scoliosis there or any abnormality on the vertebrae. Okay, so the posterior superior iliac spine, the PSIS, or in the iliac crest. Okay, so you're looking at the level on both sides. So if there's no abnormality, you're checking if one is higher or lower than the other. So you're checking the iliac crest is from the hip, okay, the hip bone. So that's where you're checking, right? So greater trochanter, you're checking as well the level on both sides. So greater trochanter it's the bone that connects the leg to the hips. Okay, so it's like the uppermost portion on the side of the upper leg by the hips. Okay, so you're gonna check on that if it's you know, there's no abnormality on both sides. Okay, so the gluteal line or popliteal fossa bilateral, so both sides, gluteal line, okay, or the popliteal, it's on the posterior area of the knee. Okay, so you're checking on that. Usually if the other one is higher or lower, when there's, you know, abnormality on the length of the legs. Okay, so next is the fibular heads. Okay, so greater trochanter, gluteal. Okay, so the knees. So we have mentioned that as well. The varus or valgus, bow-legged or space in between. Okay, and the fibular heads, if the level is even on both sides. Fibular heads is just on the lateral or on the side, just below the patella. Okay, that bone there is the head of the fibula. So you're checking on the level of that as well. Okay, and the gastrocnemius, the hamstrings. So gastrocnemius is the calf muscle. So you'll be looking at the bulk of the muscle, if it's, and the tone is how, if you know there's bigger, you know, if it's like bulky, or the tone is like you see like some, you know, some tightness on the area. And on both gastrocnemius muscle, on both lower leg, on the posterior you'll see the calf muscle, the gastrocnemius, and the hamstring is the posterior muscle on the upper leg, so above the gastrocnemius. So you're gonna check on the bulk of each muscle on both sides. So okay, so the Achilles tendon is you're looking at the shape and the size on both sides. So the Achilles tendon is that big tendon that attaches to the gastrocnemius down to the heel bone. Okay, that's the gastrocnemius tendon. So you're looking at the shape and the size as well, if there's, you know, abnormality in those, and the tendons. Okay, so the medial malleolus is located on the medial side of the heel. Okay, so just above the heel on the medial side, you're gonna check on the levels if it's even. Okay, next will be the medial longitudinal arches. if it's flat or high, meaning on the plantar, like if you are flat-footed or your arch is normal, so you're just gonna check on that as well. Okay, so the lateral view, just checking on the plumb line through external auditory meters, through the acromion process, which is on the shoulder, the slightly anterior to head and fibula, slightly anterior to lateral malleolus, so those ones you're going to check as well. And the cervical spine, the vertebrae on the neck, the posterior neck, the cervical spine. Okay, so you're looking for forward head carriage, the flat curve, okay, hyperlordosis and hyperlordosis and hypolordosis. So you're gonna be checking on that. The trunk rotation are on both shoulders should be visible. Okay, so you're just gonna check on that. The shoulder, is the position neutral? So your shoulder, is it neutral? If it's balanced, the other one is not higher or lower than the other. Okay, so the lumbar spine, so the lower back spine or vertebrae, you're looking at hyperlordosis or hypolordosis, so sway back or flat back posture. Okay, so the anterior superior iliac spine and the ASIs, and the posterior superior iliac spine, the PSIs on the back. So if there's excessive pelvic tilt, so tilting of the pelvic, the hips, okay, it's tilting, so it's not balanced. Okay, so to continue, so you're gonna check on the knees. Okay, so for if the knees is there hyperextension, so meaning the knee is super extended. Okay, as you can see from the front. All right, so now we're gonna go to check on the gait or the walking, the stance, the swing phase of walking. Okay, so if the person coming to your office, clinic for treatment, then you're just, as the client walks towards you, or if you want the client to check the gait, then you ask the client to walk back and forth. So you're looking at antalgic gait, okay? Ataxic gait, these gaits are just, abnormal. Hemiplegic, okay? So if the client has a disorder, half of the body, the client will walk with hemiplegic gait. Parkinson's, okay? You're familiar with this. In arthrogenic, then contracture, equinus, steppage, drop foot. Drop foot means, when the client is like walking, it's like giving too much effort and then drop the foot like that. Okay, with those who have conditions like stroke conditions, clients, they usually have the muscles are affected, so they walk with a drop foot walk. Short leg gait, if the leg is shorter, then you see the client's walking is abnormal. The scissor gait, the plantar flexor gait. Okay, so these are the ones that you're looking for in checking for assessing for gait or walking of the client for your notes. Okay, the next is the pain expression. Okay, so you're looking at the pain scale. Okay, so as you assess the client, you just check on the client's pain expression or pain scale. Okay, so if the client has doctor's diagnosis or x-rays, then you're gonna ask the client to give you a copy so you can double check, okay, before you treat. Now, this is important, the 4 T's of palpation, so meaning the temperature, the texture, the tenderness, and the tone of the client's muscle tissues during palpation. So this is more about palpation. Okay, so for the temperature, as you do your palpation, you use your back of your hand. You're looking at cool temperature. That means if the area is cool, then there's ischemia. Okay, reduce oxygen level on reduce blood flow on the area. Now, if the area you feel heat, then there is the likelihood of having inflammation on the area. Okay, for the texture, you're looking at, as you palpate, fibrosis or adhesion. These are not or tough fibers on the tissue, muscle tissues, like hard tissues, or scar tissues as well. If there's a scar tissue buildup, it's kind of hard as well. You can palpate that. Unusual mole. So if there are unusual moles on the body, then you have to check on that as well and record. Swelling. So in the area, if there's swelling, so you see redness and pain, you know, a little bit swollen tissue in the area. Edema is same as swelling as well. Okay, crepitus. So if you palpate the area, there's a sound, like a crepitus sound. So there's a sound that you can hear or you can feel. Now the tenderness, the other T is the tenderness. So tenderness means pain. So when you palpate, you know, you are looking for pain on the area. So which tissue the client feels pain. Okay, if there's referral pain as you palpate the area. Okay, the next one is the tone. So tone, meaning a tone of the muscle tissue. When you say hypertonicity, you're looking for hypertonicity and hypotonicity. So hypertonicity means the muscle tissue is tight. Okay, it's hard. Hypotonicity means the muscle tissue is weak. Okay, weak muscles. Mostly common when you have like hyperkyphotic curve on the like a curve on the back, on the mid back. Okay, so those muscles are weak because it's lengthened. Hypertonicity, the muscles are tight because it's shortened. Okay, now we'll proceed on to the assessment component. So the assessment component, which is the A in the SOAP note, it is the results of the objective assessments. So the results of what the clients have told you, the chief complaint or whatever the client is client complaints are. So the gait assessment, the postural assessment, the range of motion, which is the movement of the joint or whatever body part that the client is complaining about. The special test or orthopedic testing, sorry. So when a client has a problem in a certain area, like for the arms, you have to do some orthopedic or special tests to check if the client is having a problem on the area, what kind of problem, so you can determine or you can check using the special test or orthopedic test. Okay, so now for the assessment, now we're gonna use our techniques. So we can use usually registered massage therapists in Ontario are taught of the general Swedish massage techniques. So there are other techniques that the college will allow you. The College of Massage Therapists of Ontario will allow you, but this is pretty much what the massage therapy program is teaching you to during your study. Sorry. Okay, so general Swedish massage techniques. Okay, which includes all these techniques. Okay, so for positioning, there's supine, meaning the client is lying face up on the client's back, and prone, the client is lying face down, face on the face cradle, and abdomen on on the table. Okay, side lying, the client is lying side on his or her side. Sitting position, you know that the client is on seated position. Okay. So for techniques, we have here the Petrissage techniques. So Petrissage techniques such as we have here techniques like rocking, vibration, joint play. These are massage techniques. Shaking, okay, diaphragmatic breathing, myofascial trigger point, stroking, friction, and effleurets. So these are the common techniques that you can use before you start the treatment or after, so or in between. So these are the techniques that you can use. Okay, it's like a general technique. Now there is the myofascial release technique. So we have here the skin rolling, okay, and cutting techniques, the C bowing, the cross hands fascial stretch, the fascial turking, the J stroke, the fascial spreading, and S bowing. So these are to release restriction on the fascia of the muscle tissue. This is just, you know, superficial. Okay, you can use this as a start or in between or at any time that you want to use, just to release myofascial restriction on the area. Okay, so now the popular one, the Petrissage. So there is the kneading. You can use knuckle kneading, fingertip kneading, thumb kneading. Okay, so the C is scoping, okay, the stripping, the ringing, the muscle squeezing, and the skin rolling. Now with the skin rolling, you use oil. This is a Petrissage technique. Okay, so you can do light, moderate to deep pressure on these techniques. Okay, so the Tapotement technique, we have here from the less pressure. So we have pincer, the cupping or clapping technique, the tapping, the beating, pounding, and the hacking. So the most common one is the hacking or the clapping technique. Okay, so yeah, this is good for the to reduce muscle tightness, like especially on the gastrocnemius area or the calf muscle, the hamstring, the quadriceps, the upper the anterior or the posterior upper leg, the hamstrings, and the quadriceps muscles, and especially on the back. Okay, where the neck area, the trapezius area, where the in between the scapula, and in a little bit on the rib cage area. Okay, so you can use Tapotement. Now, for your postural assessment, you have here a space to write down as well. Okay, so this diagram or drawings will help you. Just included it here to help you to, you know, have a during your assessment, so you have a way of checking for the gait or the stance, what is the stance phases or the swing phase of gait or walking of your client. So you can write your notes in here as well, so it's okay to write notes, so it's placed there for that purpose as well. So for your postural assessment, so if with the head and neck, shoulders, spine, hips, lower back, so if you see the drawing corresponds to your assessment, then you can write a note on here as well. Now the same as well, there are two postural charts here. Okay, for the moving on, so we continue for the range of motion. Okay, so range of motion of movement, say if the client has complained on the shoulders, then you're gonna do movements, all the movements on the shoulders to determine the degrees of limitation of the movement, or if the client has pain in any of the movements. Okay, so you can write down your notes here as well. Okay, for the fingers, then the legs you can see, and the head or the neck as well, you can write down your notes here as you do your movement range of motion of the client. Okay, so the ankle joint as well, you can have your notes here as well. Okay, and in this area, I just, you know, put in the normal range of motion values with client's results, so it would be easy for you to have a reference, or the reference in what degrees, the normal degrees, in what degrees you are looking for normal assessment on the client's range of motion of each of the area. Okay, so about active range of motion, so you're looking at degrees, as you can see here. And the passive range of motion, you're looking at end field. Passive means you're the one, as a therapist, you're the one doing the movement for the client. Okay, the active, it's the client is the one by himself or herself doing the movement, so you're just checking on for any abnormality. So you're just gonna write down here this on the spaces, the blank spaces, the results. And on the left side, these ones are the one your references for the normal range of motion values. Okay, good. Okay, so to continue, so these are the range of motion values as well. Okay, for the fingers, the thumb, the lumbar, the hip, and the knee joints, the ankle joints. Okay, so those are the normative values that for your reference. Okay, so for orthopedic testing, we're gonna be testing the head, the neck, the shoulder, the wrist, the lumbar, the hips, and the ankle. So for in this area, you're looking for to test the client some of the special. You're gonna use a special test or some orthopedic test to determine the client's problem. Okay, before the treatment. Okay. Now we move on to the plan component. This is the P in this SOAP note. This is SOAP note information. Okay, so the massage treatment plan includes the plan for initial treatment, the follow-up assessment, the result of the massage treatments, and the client's feedback. Succeeding treatments such as the time, date, and duration. So for the initial treatment, you have a space here to write down your notes. Okay, so it includes your treatment goals, which are, we have here some examples. So your treatment goals are to reduce sympathetic nervous system firing, your fight and flight response. Okay, next, to reduce hypertonicity or trigger points. Hypertonicity is tightness of the muscle tissue, and trigger points, do you know if there's trigger points means there's a knot in the area and there's pain. Okay, so next is reduce fascial restrictions. So the fascia is restricted, so you're just gonna reduce fascial restrictions, and fascial release techniques are best on reducing fascial restrictions. Okay, so to treat any compensating structures, so it's not only the problem area that you are going to treat, but the compensating structures are those structures that are not directly affected by the area that has problem. Those are the structures that are doing the action because of the problem area can no longer do the action or the job. Okay, so the other areas will compensate, will do the job will do the action of the person or the client. Okay, in doing some movements or doing anything like to move their muscles. Okay, then mobilize, you have to mobilize hypomobile joints. So in the massage treatment, you don't only have to do the use massage techniques, but you have to use some mobilization on the joints, like the shoulder joints, the neck, the hip joint, the knees, the knee joints, and the ankle joints, or the wrist joints. Okay, so you're gonna incorporate those mobilization techniques in your massage. Okay, in your massage therapy. Now, to maintain strength. Okay, so your techniques could help maintain strength on the muscle. Okay, and reduce pain if present. So if there's pain on the area, then you have to use the massage therapy can reduce that as well, reduce pain. Okay, so reduce inflammation or edema. There are techniques how to that can reduce inflammation or edema in the massage treatment. Okay, so that's one of the goals. And then maintain local circulation. It's always important. So massage therapy will always increase or maintain local circulation. Local circulation like the blood circulation or the lymph circulation. Okay, maintain range of motion. Okay, so like I said, joint mobilization will increase or maintain range of motion of the limbs on the joints, or movements of the joints will increase. Okay, if it's limited, then massage therapy, mobilization can and treatment can help increase that gradually. Okay, next is to reduce spasm. So if you are experiencing a spasm on an area, then massage therapy can reduce the spasm. Okay, so then you can refer the client if if you feel like the client needs referral to like a chiropractor or a physiotherapist. Upon doing, while doing the treatment, you figure out that the client needs a referral to these practitioners. Okay. Okay, on the plan component, as we mentioned, there's the follow-up assessment. So this is the result of the massage treatment. So you can write down your notes in here for follow-up assessment. Then you're going to ask the client feedback. Okay, so after treatment, you're going to ask the client feedback, and then you can write it down here on your notes. Next, you're going to tell the client of his or her succeeding treatments. So what time, date, and the duration of the client's next treatment with you. Okay, so we're gonna add, after the treatment, you're gonna give the clients home care or hydrotherapy. Okay, so hydrotherapy as home care, you can use cold hydrotherapy, which is to apply cold compress or apply ice on the sore areas for at least 2 to 3 days, and which is just a normal sensation. Okay, so you're just going to tell your client to apply ice pack or do a cold compress on the sore areas. After the treatment, it's going to be to just reduce any discomfort. Okay, so hot hydrotherapy, you can tell your client to apply hot compress or use hot packs on the tight muscles to increase local circulations once in a while. Okay, for hot hydrotherapy. Now, for cold and hot hydrotherapy, which is a contrast, so you start with hot first and then you end up with cold. That's to do like hot compress or hot packs, then you end up alternate with a cold compress or ice pack. Alternately, alternate once in a while for contrast hydrotherapy. It's useful for treatment as well as home care. Okay, so immersion hydrotherapy or bath. So you're going to take a warm bath. It's needed. Okay, so once in a while, it's like as needed. Okay, then you're gonna tell your client to drink lots of water at home and to drink up to 2.5 liters of water or as much as client can drink daily. Okay, so you're just gonna advise your client for home care. Okay, drink lots of water. Now for clients, remedial exercises. So you're gonna tell or show the clients to do some strengthening exercises or stretching exercises to help with their therapy on the problem area. So you ask the client to do self-care or exercises at home. Okay, so just read on the information here. Okay, so I have here a list of exercises that you can give your client. So for the neck, there is gentle neck flexion stretch, chin tucks, neck retraction, head drop, levator scapular stretch, and so on. Okay, for shoulder, there is general shoulder active stretch or shoulder blade pull, shoulder squeezing. This is a popular one that I usually give to my client, shoulder squeezing. Okay, so you can give to a client these exercises. Okay, for the lumbar. Okay, so the lumbar, you have pelvic tilt, lower trunk rotation, the bridge. Okay, so knee to chest, hamstring stretch. Okay, bending extension, side bending, and rotation of lumbar exercises. So that's for the lumbar area. Okay, you can give this to your client. All right. Okay, for the rotation of rotator cuff, exercises. So you can do a doorway stretch, high to low rows, side lying external rotation, lawn mower pull. Okay, those are the exercises you can give to your client. For the hips, there is hip rotation stretch, there is frog stretch, and others as mentioned here. Okay, just take a look at it. Okay, the quadriceps muscles exercises. So there is straight leg raising, the wall sides, or the short arc quads. Okay, so these are popular exercises for home care for the quadriceps. Now, for the hamstring stretch exercises, so you have the hamstring active stretch, the straight leg hamstring stretch, which is popular, okay, and so on, right? Just take a look at it. Okay, there is as well the gluteal muscle exercise. So I have one here, side leg raise for the glutes, okay, exercise. So for the calf muscle exercises, we have the heel cord stretch, partial weight bearing seated calf raisers. So those are the exercises for the calf. Additional for calf is toe dips or the calf stretch, okay? So you can do that as well for self-care exercise for your calf muscles. The tibialis anterior stretch. Tibialis anterior is the front of your lower leg, okay? So the elastic band foot drop exercises. So you're gonna use the elastic band. And the anterior tibialis strengthening with a calf weight. So you have weight. So you're just gonna use the calf weight, and you do your lower leg exercise with that. Okay, so there are the ankle exercises. So there is the ankle pump up, the two rise, the ice bottle massage. Yeah, you can do that. Inversion isometrics, eversion isometrics. There are others as well, as you can see here. Just take a look at it. Okay, so if there are other exercises that you may give your clients, so you can write it down here on the other exercises as in your notes. Okay, so there you go, guys. That ends the topic for today for soap notes. I hope you have enjoyed my video, and I hope this will help you or guide you in your study of your massage therapy program. Thank you for watching, and please subscribe to my channel, and you have a great day.